And next, my other dear friend and colleague, not my only two dear friends and colleagues, but two of them, Stacie Pinderhughes. Stacie directs the Division of Palliative Medicine for the Banner Health System, which is a very large multi-hospital, multi-state system, and was a geriatrics fellow, right, with me, how many years ago? A long time ago. So we go back. So welcome, Stacie.
Thank you. All right, so I'm going to ask the continual question, how do I go forward? How do I go back? Is this it?
The green arrow goes forward,
Okay.
and the red arrow goes back.
Okay, thank you. Well, good morning. It's really wonderful to be here with everybody, and I want to thank Diane for being a wonderful mentor, but also for all that she does to continually advance our field. And Vicki and David, I listened to you all talk at CAPC, and it was just, an amazing presentation then. So please don't stop what you're doing. Please continue to talk and talk about your experiences. I took your journey and your words back to Banner with me, to our teams, and it really helps the clinicians and the individuals in the field to hear from the voice of the patient. So thank you. So I was asked today to talk about the health system response to, or how do we go from volume to value. And so this is a busy slide. Don't even try to read it. Don't try to take it apart. I'll kind of orient you to it. But the first three slides that I want to go through kind of frame for me some of the broad issues that we need to kind of think about as we approach value from the volume perspective. And this first slide really kind of gets to the patient experience. And you all are going to hear a lot of patient stories today, I'm sure. This is another patient who was vulnerable and scared and on the gerbil wheel that we talk about within the health system. She was in her 70s when we met her. She had end-stage lung disease, so her lungs didn't work well. She had end-stage heart disease, so her heart had trouble pumping and caused fluid to continually back up into her lungs. And then she had end-stage kidney disease, so her kidneys weren't working and she needed to have dialysis 3 times a week. And that was becoming hard because she was getting closer and closer, unfortunately, to the end of her life. But what this slide really speaks to is that in 2015, at least, from January through June 4th, she had had about 7 or 8 hospitalizations. And anybody in this room that's ever been hospitalized, has anybody ever been hospitalized? I have, and had surgery. It's a terrifying experience. And so for somebody who is vulnerable, who isn't a nurse or a doctor, and who doesn't have an advocate, this is terrifying. And that's what she was experiencing all throughout her admissions. And I think that what this exemplifies for me is the need for us in the healthcare system to fundamentally change the way our organizational thinking is and the way our cultural thinking is, to really understand that we have responsibility for our patients and members wherever they are at across their healthcare destination. So imagine this. Imagine if the providers that had seen this woman back in May, back in June, looked at her not from this transactional perspective of she comes in, we do more, we charge more, we send her out back to rehab, she comes back in again and again and again. But imagine if somebody said, well, wait a minute, what's going on here? How do we speak to her? How do we tell the truth? How do we discuss what achievable goals are for her? And how do we make sure that we set up a plan so that she doesn't have to keep doing this? I think that that is really one of the major imperatives for the health system. It is a fundamental cultural change for us, the people at the bedside, and how we engage patients. I'm sure that many of you have seen a slide like this before, but it's really telling and it's really distressing for us from a sort of a global perspective. So on the x-axis is life expectancy, and on the y-axis is health expenditure and all of what health expenditure takes into account. But the red line you can see is the United States. And what's striking to you guys about that, compared with all of the clusters of the other developed countries on the top? Yeah, right. So we pay more, we spend more, and we don't live as long. And that's shocking, isn't it? In a country where you can get second and third and fourth and fifth line chemotherapy, that's probably not going to help you. We still don't live as long as countries that provide health care to all their members. And then this slide, I don't want to spend a lot of time on, but it's a nice sort of summary of health services models. And I think that no model is perfect. Everybody is trying to manage how do you provide the coverage, how do you provide the access, how do you increase satisfaction, and how do you lower cost. Everybody's trying to figure out how to do this. Nobody does it perfectly, but certainly in the centralized countries where they have universal access and uniformity with regards to pricing, people seem to be living longer than they do in the United States. So we still have work to do. So Banner is a large health system in the southwest part of the country. We are 28 hospitals across 6 states. We have 2 large physician groups. We are very organized from the perspective of the physician work group. We just purchased about 23 urgent care centers. So Banner is big and large and growing and trying to figure out how to do this population health like many other systems are across the country. Just briefly, I want to show this to you because I like the sort of intentional stepwise progression that you see here. But what I want to say about this slide is that I think that many health systems are trying to approach the transition from volume to value in a very thoughtful, measured process that they are mapping out over time. That's at least what Banner's been trying to do. Back in 2002, Banner emerged from a financial turnaround, and the focus was on becoming a clinical quality company, so demonstrating excellence in terms of our quality outcomes. And I think by and large, Banner has done that well. But then as you follow the progression forward, that really poised Banner to try to move into more of a population health realm. So I think the importance here in terms of, again, health systems is that there has to be some sort of intentionality and process behind which you're going to frame the journey towards value. This is another slide that's busy, so again, don't try to read it and take it apart. Just kind of focus on me and I'll take you through it. What this slide is saying is that the post-acute setting is everything outside of the hospital, what Dr. Twaddle was talking about. So it's the nursing home, it's home health, it's the rehab, it's the LTAC, but it's everything that is occurring outside of the hospital. And it is the fastest growing part of the healthcare spend. And I don't know that people always get that or realize that, but it's costing a lot of money. And so the imperative for the health systems are to figure out how to manage better the post-acute setting, and again, how to deliver a consistent, safe, reliable, effective, timely product to our members in the post-acute setting. So if you're an organization like Banner that is a population health focused organization, you are really, again, as I said, working hard to try to change that organizational structure from the very transactional, you do more, you get paid more mentality and framework to a fundamental shift in our thinking that makes all of us understand that we have responsibility for the Eleanors and for the Vickies, whether they're in front of us or not at that moment. We have responsibility for the whole totality of their care. So one of the things that Banner is doing to try to fast circuit and move forward innovation in terms of value is this concept of Imaginariums. So Imaginariums are just kind of what it says here. They're a launch pad for new ideas about how we deliver services to meet consumer needs. And I'm not going to go through all of them because we don't have the time and we can talk about it in Q&A. But in particular, the Medicare Advantage Imaginarium will focus on the needs of those vulnerable Medicare Advantage members and helping them to know what to expect from their providers and from the system in terms of their health care. This is primarily set in our Sun City area, and if any of you know anything about Phoenix, it's a high population of Medicare Advantage members, but it will use a number of individuals within that catchment area to try to rapidly move this innovation forward. Just a little bit more detail about why I think this is so exciting and has a potential to really innovate and be successful is that the Imaginariums are going to be independent from the business of Banner. So they will be their own separate business entities so that they will be forced to be able to create and not have to worry about the sort of standard cumbersome, busy structure of the health system and long process of decision making. Diane asked me, what is the health response, what is the health system response of volume to value across the nation? And I really didn't have a good answer for that in my capacity as a physician leader. But what I did was I went and talked to our Senior Vice President of Strategic Growth, who does go across the nation and talk with a number of individuals. And you can see his comments here. Basically what I've heard from many people is that the response is driven by a number of things. It's driven by the market. It's driven by the health of the economy in the local and catchment area. It's driven by the level of competition in a given area. And importantly, it's driven by the physician groups. And how organized are they? How sophisticated are they? How large are they? How able are they to deliver the care? So all of these things come into play. In Arizona in particular, I can tell you that Banner is probably the largest player on the block and probably doing the most to move forward with innovation in terms of value. About 42% Medicare Advantage penetration in the market, and Medicaid is 100% managed in Arizona. So the stressors are many. This is another quote from one of our higher level CEOs. She said, "What we're trying to do is fix the airplane while we're flying it." And everybody here can relate to that, I think, and health systems across the country. Everybody's trying to do this. And underneath that whole, paradigm of fixing the airplane while you're flying it are all of the things that Dr. Twaddle talked about, all the things that, Vicki had to deal with or has to deal with in this journey, the lack of access, the fragmentation, the cost. Dr. Twaddle and Dr. Myers talked about this a lot. Healthcare is becoming the number one cause of personal bankruptcy. Healthcare costs now account for half of the typical mortgage payment for the middle-class family. So it's a problem. And of course, everybody knows we don't have any sort of transparency with regards to pricing in our system. So the stressors are many, but it brings us back to this, which is the value imperative, which is where we all are trying to get to, because the patient is at center. The patient is why we do this, and the patient is what matters the most. So we're all trying to improve quality, and to do that continuously. We're all trying to reduce that fragmentation, doing it at less cost. But what Martha was speaking to, we have to do this in a way that's respecting of our workforce. I mean, many of us are just burnt out and exhausted, and so you can't deliver this care in a compassionate, effective, efficient, timely manner if you have doctors and nurses and aides that are exhausted and burnt out and, unable to do their jobs. So that's a huge, tremendous part of the triple aim, the quadruple aim, I think, in the value imperative. So I'm going to bring this in for a landing, and our CEO, Peter Fine, always talks about the essence of transformation being necessary disruption, and I think that he's absolutely right. We are working in a very disruptive environment and culture, and we probably will continue to do so for very many, many years going forward. So these are some suggestions for working in a disruptive environment. I will tell you some of my favorites are always sort of question the status quo, get comfortable with having more questions than answers, and then start with kind of your end product in mind. Those are three of my favorites. So again, it's been an honor to be here with you guys this morning, and I look forward to the rest of the day. We're going to have a lot of great conversation and discussion, and I will leave you with words of Einstein, very relevant to the topic we're talking about today. We can't solve our problems with the same thinking we used when we created them. Thank you.